anything interesting?
So I believe we have a 7-year-old who's being brought in by the paramedics. ETA was about 3 to 4 minutes when we were last home. I guess I understand you guys are busy. So this kid is being brought in because he's unusually drowsy and wasn't taking a drink on time. Mom offered a drink earlier today. Mom unfortunately has a history of some alcohol issues, so we might not get the best history from Mom.
Okay.
I think.
At the moment, just drowsy,
Yeah.
unknown cause, so no other history, difficult to get the history.
Yeah.
So if we're happy, do you mind putting in some monitoring kind of
Obs, sure.
Perfect.
Sorry, are they candidate? Do we know?
Or don't
We don't know.
We have no idea.
Yeah, I'll just concentrate on access. I'm doing that. Do you want to do
Do the red
flag?
flag?
Yeah.
I'll just
Yeah, that'll see them.
yeah, sure. I'll get some ID, but I'll get the just in case I'll get the IO out as well.
And how old did we say they were?
7.
7.
I'm assuming a weight of 25 kilos.
Age of
Yeah.
20 years.
Yeah.
After that. I'll come the area, but after doing that.
It's IOs. You have the IOs in here, don't you?
Yeah.
Just check. Yeah.
Just make sure you've got the right size for a 7-year-old.
Yeah.
You take a pink and yellow on both, just and check the
Pink and yellow, yeah.
and just check the guns working. That's okay.
Yeah. Got a thing here.
Just check the batteries, make sure the batteries are full.
Yep.
Are we happy? Do we need anybody else, or you think we've got enough people?
I think from an anesthetic point of view, we'll get some history, see what he's like, and then we can escalate the problem.
Yeah, sure.
So, how are you feeling from a paediatric point of view?
What's that, sorry?
Are you feeling confident as a paediatric as a surgeon?
Yeah, sure. I mean, I think I guess we'll see what happens. If I feel a bit out of my comfort zone, I'll give the senior ring and see what we're dealing with.
Brilliant, perfect.
How are we getting on with the red flag?
Yeah, I was just.
Yeah, that's the one that I know.
I was going to say what.
There's too many choices.
2 per kg, so that's 22. And this would be 2.2 milligram. Adrenaline would be 1 mg per kg, so that's.
Gosh, I hope they haven't crashed or something like that. So are we in the right place?
Well, you know,
Well, it's going to take it's going to
you can
take
generally hear them when they get close. They're normally driving a 1970s ambulance. You'll hear them.
Yeah.
It's just like you jinxed us a little bit there.
That took a while.
No, it doesn't. It's just in time, actually. Oh no, I'm not sure.
We'll be having a bit of a. It's closest to us, ambulance.
Did we say if mum was coming or not?
What did it actually say?
No.
Not that.
Come on then, I'll grab your feet. Here we go.
Not me.
Right, hi guys. Hi. Okay, hi. Right, I've got a 7-year-old, I think, T. Jeffries. From mother, at home, the house is squalor, honestly. The mother, like, bottles of cider, empty bottles of cider, empty bottle of vodka around, it's kind of like that. Avanti, barely responsive, to be honest. Breathing, respiration, it's all right, a bit fast. I just took the oxygen off now, so if you want to replace some oxygen, that would be great, thank you. Yeah, I don't know what's going on, just super unwell. Feels tachycardic, pulse is a bit thready, bit shut down. looks a bit toxic, to be honest. I don't think it's alcohol or methadone overdose, anything like that. It seemed a bit more sort of sepsis to me, but I don't know.
Okay.
Do we have a temperature?
I didn't get a temperature, no, but she just felt hot to the touch.
We'll get a full set of bobs.
Yeah.
Has she had a BM done?
I haven't done a BM, I haven't had a chance.
No,
And I couldn't get IV access. She looked shut down. I did a scoot and run.
That's
I was
great.
only like 6-7 minutes away, to be honest. I just thought I'd better get her in.
That's great. Thank you
But
very
yeah,
much.
no, nothing to do with stay at the house.
Any family come with you or?
Mum is at home. She said she's going to get someone to bring her. She was in tatters.
Okay.
She thinks she's missed something, done something wrong. I think, to be honest, she was going to get in the way.
Fine, no problem. And we heard something about a grandma.
Grandma, yeah,
No.
lives
No problem.
nearby or something.
Okey-doke.
Why? What did you hear about Grandma? What she done?
Well, was grandma the one that found her? So that I was half
I saw
expecting
Mum at
grandma.
home.
Fine, no
I saw
problem.
Mum at home.
That's brilliant. Are you happy to get started with some observations? Are you happy to go with the
That's all right.
That's great. Do you want to do an A to E then?
Yeah.
She feels very hot.
Okie dokie.
Sorry, we can catch your name again. It was
Uh-huh.
Was it Tina?
Tina. Tina, hiya, my name's Hassan. I'm one of the doctors.
That's a 93 on oxygen.
All right, and that's 100% valid. Breathe.
While she's breathing.
I don't know.
What's her resp like?
Okay,
Look quite rapid.
fine. Can I see any misting on the mask or any signs of?
There's misting, but it's quite rapid.
Okay, and can I hear any additional sounds?
Not that I can hear.
Okay, so no noises. Okay. B-wise, what's her respiratory?
She feels a bit shut
Blood
down.
pressure's not picking up. It's either low or not on top.
We'll have one go, and then
Okay.
if we're not winning, then we'll go straight for the IO, because she
Fine.
does look quite
So-
shut down, doesn't she?
B-wise, we don't know, we don't
Alright,
know
so
respiratory of 30.
We've got a pulse of 150, sats at
Fine.
92, respiration rates up to 30.
30. Okay. And
Blood
can I
pressure?
feel a central
Yeah.
pulse? You said I couldn't.
It's not. We're not. I don't think I'm going to get any access in there. She's too
Oh,
Hold
short.
on,
right.
what's that there?
Are you confident with the IO?
Yeah, I'll follow
Okay.
IO. Yeah.
Perfect, because then immediately after that, we're going to get some fluids then if she's feeling quite shut down.
Fine, so we've got a broken bone.
No.
Or what appears
Is that
to
a
be
rash?
deformity.
Is that a rash? Is that meant to be a rash?
Looks
Yeah.
like Russian.
Oh, good.
There's a rash on the neck as well.
Right, and there's a rash on the neck. What's her
Fine.
pupils like?
So temperature's 38.5 there.
38.5. So she's febrile,
Okay.
she's drowsy, she's got a rash. What were her pupils like there? Anyone?
Sorry. Do you think we need a pair of hands or do you?
Well, I think this looks like a sepsis, possibly meningitis type picture. She needs a fluid bolus of 10 milligrams per kilo, which is 220 mils as soon as we've
Sugar's at
got
2.9.
2.9, and she needs some glucose. So can you first get the glucose, please? So that's 44 mils of 10% dextrose we've got. Are you happy to do that?
Yeah.
Hassan, do you want to run some fluids through? And then we can give her a fluid bolus as well.
Okay.
Is that all right?
I'll complete.
How
the
come
rest.
can you do the A to E?
What's that?
I was just doing different fluids.
So
10%
I'll put
dex.
some fluids up, I've run through, you just need to catch.
Okay. We also get some 10%
Having a little
dex.
listen to her
Yeah,
chest. Anything?
We still don't have access. Okay, we seem to
We're
have
getting
just have had access. Fine. We'll run the 10% dextrose. That's okay.
Yeah, got it.
50 mils worth, and then we'll run the next through. Are you all right doing that?
Yeah.
Brilliant.
So when I listened to her chest, did I hear anything?
I don't know. Let's have a look. Do you mind if I have a little listen? Is it okay?
Yeah, you
Have
have.
you got these sets?
Yeah, it's just you.
I've got access there.
I don't mind. It's almost there. Can you just finish wrapping that up for me, please, and just get the insert on?
Fine. I'll get the giving set on if you want to keep.
Well, it's going to need a 50 ml syringe if it's IO.
Okay.
So we're just going to have to push it through.
It sounds fairly clear, I think.
Okay. So
It sounds fairly clear there.
Fine, and there's no. So from an airway point of view, A, there's no added sounds. We said she's maintaining her own airway. B, it's not super great. She's on 100% oxygen. She's got sats of 93%, but her chest was clear.
She's not with it.
She's not with it. So she's still got reduced GCS, but that could be because she's got a BM of 2, she
Yeah,
said,
she's-
which we are now
You've got a
treating.
freeway tap.
It could also be a sepsis related.
Yeah.
So we're going to get a fluid bolus, we're giving her some glucose, we want to get some antibiotics. I don't know what the antibiotics are for meningitis off the top of my head. Is it ceftriaxone and acyclovir? But I definitely don't know the doses.
I'll check with the PLS guidelines.
Perfect.
So should be some guidelines, I think.
Is there anything else that we want to do? Once we've got that fluid attached, we can give her that bolus.
So it's sugar or fluid?
Can we get another IO then, actually?
So you're going to have to do one on the other side unless you've got a splitter?
I can do one on the other side.
So let's get the glucose attached first.
Sugar first?
Yeah, definitely sugar
Can you get one on
first.
there? Right.
With a BM of 2, we'll go sugar first. We'll get another lot of access.
Yeah.
I mean, I can also have a look for IV access if I'm likely to get IV access.
For the septic shock guidelines here, but I can't seem to find the one specifically for meningitis.
Septic shock sounds good.
Yeah, so the nectar septic shock guidelines. So antibiotics wise that you wanted to know, IV Kef and IV acyclovir.
There should be meningococcal guidelines in there. Just have a little look. We found them. Okay, I'll have a look for you.
Yeah.
Okay, just make sure that we've got good access.
Now,
I'll have a look.
I think what we can all recognise is that this is a very sick child. We've
Sepsis.
started initiating management of a low BM and of the possible meningococcal sepsis. We're giving her some glucose, we're getting some further access to give her some fluids, we're going to give her some antibiotics, but this isn't the best place for her. We need to call the paediatric consultant and our anaesthetic consultant,
Yeah.
and then think about whether or not we're going to need to intubate her and stabilise her for transfer out to a PICU. So,
And anaesthetic nurse as well?
and an anaesthetic nurse, if we're going to be intubating, absolutely.
Yeah, before you speak to the anesthetic consultant first.
Yeah, go ahead. Paediatric SHO John, are you happy to contact your consultant?
Yes, I'm give him a ring now.
Perfect, thank you.
Okay, 2 seconds.
And I'll get some of the access.
CDFT switchboard.
Oh, hi, this is Hassan, one of the anesthetic trainees. Can I speak to the anesthetic consultant on call, please?
Hold the line, please.
Hello?
It's Des anesthetics.
Oh, hi, Des. Hassan speaking, one of the trainees. Right, very well, thank you. Sorry, I was just calling you about a poorly child that Jane and I have just seen in A&E. I was wondering if I could talk to you about them. So we've one a 7-year-old female by the name Tina who was pre-alerted about 10 minutes ago as a sick and poorly child with really dodgy domestic circumstances. Quick A to E review from the end of the bed has basically led to a overall impression of septic shock. So she is maintaining her airway. She's just about maintaining SATs on high flow oxygen at 92% with 15 liters via non-rebreathing, RESPs of 30, no focal chest findings. She's peripherally quite shut down. Blood pressure is just about 70 by 60, non-invasive. She does have a rash that is evident on the neck and the arms, and she's basically unresponsive to pain. We've ran some fluids and some sugars through. We're just setting up some antibiotics. Fairly concerned that this child probably needs probably PICU level care. I haven't involved the pediatric consultant yet, but I'm going to. I was wondering if you'd be all right to just come down. Say,
Absolutely. Yeah,
if that's okay.
I'll absolutely come down. I'm going to be from here about 10-15 minutes. In the interim, how much fluid have you given so far?
So we've given 50 mils of Dex, 10%, and then we're just about running a fluid bolus of 220 mils. And we're going to repeat a few more.
How much you given Dex, did you say?
So 10% Dex, we've given about 50 mils, and then we're going to give a...
Did you say she had low BM?
Yeah, she had a low BM, yeah.
Right, okay, and what sort of the fluid you're going to give?
So we're going to give her 220 mils of saline and then just titrate that. I think she's only had just the one. I'd say she weighs about 22 kilos.
Okay. Yeah. All right.
Yeah.
You can give that a rapid bolus, reassess,
Yeah,
give
yeah.
another bolus.
Yeah. Yeah.
So it sounds like you think about intubating her.
Yeah.
Right. Okay. So what do you want to intubate her? I mean, I'm going to come down anyway, and hopefully I should
Yeah,
be
yeah.
down by that point anyway.
Sure.
What do you want to intubate her with?
I think we're probably going to go with a cat rock. We're going to go with a cat rock RSI. Is that what we've been planning? Yeah.
So
A cat and rock RSI.
ketamine 2 milligrams per kilogram, rocuronium 1.2 milligrams per kilogram. That sounds good.
Yeah.
Be careful on these ones. Well, I mean, as I say, I'm going to come down. Let's get a couple more fluid boluses in. I shall probably put the bed there for intubation. The other thing you might want to think about if she's severely circulatory compromised is having an adrenaline infusion ready and go. What kind of circulatory access have you got?
So we've just got the one. Well, as of now, we've got 2 IOs. She's peripherally shut down otherwise.
2 IOs. Okay, right. And on one of those, we could get prepared an adrenaline infusion. So that'd be 300 mics per kilo. And as we go off sleep, start it at 1 milliliter per hour. 300 mics per kilo in a 50 ml of 5% dextrose. 300 mics per kilo, and would start at a mil an hour, probably for induction. Start it a little bit higher than that because these guys kind of tend to collapse from what you're telling me.
Okay.
The other thing we can ask for if we get chances of albumin for the 3rd and 4th boluses.
Okay.
Have you looked at the guidelines for antibiotic cover?
Yeah, I've just got them for the meningococcal disease. It's just my hand right now. I believe it is. I think it's. I'm trying to figure out what antibiotic specific.
Ceftriaxone or cefotaxime, probably 50 milligrams per kilogram.
Yeah, ceftriaxone. Yeah.
Yeah. Okay. And let's get those in as soon as possible.
Yeah.
Have you got enough? I think consultant paediatrician's definitely a good idea, and once they come down, they can start getting in touch with Nexus so we can focus on the patient.
Yeah.
Have you got an anaesthetic nurse coming down?
We don't have an anaesthetic nurse yet. We have a A&E SHO and a A&E nurse. But yeah, I can ring theatres to ask for an ODP.
I think that's a really good idea because it frees the A&E nurse up and it might get a bit sketchy.
Yeah.
Cracking.
Okay.
Anything else you want to talk about at the moment in terms of preparation?
No, I think we'll just crack on with what you've advised and try and hold the fort until you arrive.
Fantastic. I'll see you soon.
Cheers. Thanks, guys.
Bye for now.
Sorry, Jane, that took a while.
Not at all.
It was just, he's going to be 10 to 20 minutes in the interim. We'll, so C-wise, we're going to try and give a few more boluses of fluid, preferably the 3rd and 4th bolus being albumin. Antibiotics-wise, Kef at 80 milligram per kilo. And then we've got enough access. He's also advised prepping an adrenaline infusion, which I'll advise him how to prep that. That's okay.
Brilliant.
And
have we got the? No, sorry.
Sorry, keep going.
No, I was going to say, have we got the nectar guidelines on how to draw up the adrenaline infusions? Have we got that?
Yeah.
Did you mention gas or?
No, but we can take one if that's okay. Yeah.
I was wondering. Because the only blood we've got so far are from the IO, but that blood can't go through the gas machine, can it? So we just need to get a cap gas. Yeah, perfect.
Yeah.
And is your paediatric consultant coming?
On the way.
But is the peds consultant aware then?
Yeah. On the way. Yeah.
So they've had 1 bolus of fluid so far. They're on the 2nd bolus of glucose because their BM is still low.
Yeah.
We have got some bloods, but we need to get a cap gas. Are you happy to calculate the exact doses for the antibiotics and make sure that... Have you called for the ODP?
No, so I'm going to do that.
Sorry, Hassan, please do that now.
Could we prep the antibiotics? So Kef, it's 80 milligram per kilogram. For 22, that's...
It's all right. Bring the ODP, and then we'll get that sorted, and I'll ask.
Are you happy to do the drop in button?
Yeah, I'm nearly through. Just checking this out.
Hello, switchboard.
Hi, this is Hassan, one of the anaesthetic trainees from A&E. Could I speak to the theatre coordinator, please?
Yeah, one moment, please. Hello, theatre Dean speaking. Can I help?
Hi, this is Hassan, one of the anaesthetic trainees from A&E. Hiya. I was just wondering if you'd be able to, if there's a ODP who can come downstairs for a emergency pediatric intubation that we're trying to prep for, if that's okay.
Oh yeah, I'll get someone. I'll get one of the staff to come down now. Where's it?
Yeah.
ED resus.
A&E resus, preferably. So it's a 7-year-old, 22 kilos, tube 5.0, 5.5, cuffed and uncuffed, if that's okay.
Yeah, I'll pass that on to them, and we'll get someone down in the next minute or two. All right.
Cheers. Thanks.
Bye.
Right, so the ODP is going to be 5.5 cuff and cuff.
Fantastic.
Antibiotic wise, sorry, we got
Yeah.
We're on antibiotics, thank you very much.
Okay, are you?
Acyclovir, what was the dose for acyclovir?
so there's no recycling.
Okay, we'll get stop there.
Oh, fabulous.